Welcome to our webinar on the Colorado NPI Law. My name is Chris Underwood. I'm Director of our Health Information Office here at the Department of Healthcare Policy and Financing. In this webinar, I'm going to briefly address revalidation for our providers and then get into the detail of our draft regulations we have to implement the Colorado NPI Law. First off, every 5 years, providers need to revalidate with the Colorado Medicaid program. This is a requirement under the ACA that every provider, once they've enrolled, must revalidate with us to verify that they're currently our legitimate provider, they're enrolled correctly. It also allows the department to do some background checks and some other updates to our provider directory, so we have a current provider listing for all our members when they seek services. We will start this revalidation process in April of 2020. It has been 5 years since we started our enrollment process into our new Colorado interchange system for our providers, so we're coming up on those deadlines pretty soon. What's important to remember about the revalidation process is that we will give providers 6 months notice to begin that revalidation. You'll get a link through your email telling you it's time for you to revalidate and what your deadline is. We'll give you 6 months notice ahead of time through that email, and then you'll go into a special portal that we have that will allow providers to update their information. It will not be the same process as providers did when they first enrolled. Instead, we'll have you look at some information, validate that it's still correct, and then update current licenses or other documentation that's required for that revalidation. When we get closer to the revalidation process, we'll have fact sheets, trainings, and frequently asked questions available for our providers to look at. What's really important right now is providers go into the portal in the Colorado Interchange, their provider portal, and make sure that the email addresses for their enrollment staff in their profiles are updated. That's the way we plan to communicate. So if you don't have a current email address in your provider portal and you're not getting notices from the department, odds are you're going to miss that provider revalidation update. So we want to make sure everyone's going in there and updating that information. So when providers begin the revalidation process, one thing we'll be looking at is how we need to implement the new Colorado NPI law. This law came into place in the 2018 session, and it requires that all newly enrolling and currently enrolled providers have to obtain a separate and unique NPI for each service location and provider type that they enroll in the Colorado Medicaid program. So starting in 2020, the department will require providers to submit a claim with a unique NPI so that the department members and policymakers have more transparency to where services are being provided. Over the years, providers have expanded to create a number of separate physical locations for the delivery of health care. When our individuals on the Medicaid program seek care at inappropriate locations, the delivery of that level of care in that setting can increase costs to the overall healthcare systems. So we really want this transparency to have these separate NPIs by location and provider type, so we have more transparency to where services are being provided and to verify that services are being adequately delivered to our clients. So first off, as a provider, you probably know what an NPI is, but there may be some folks out there that don't know that these are national provider indicators that are given to healthcare providers when they sign up through the federal system. Those provider numbers are unique and have their 10 digits number that each provider can have. Currently, most providers are using their NPI for billing purposes to the Colorado Medicaid program or to also Medicare if they participate. With that, getting an NPI is actually an easy process for providers to do. They can go on to the federal website to get a new NPI, and it doesn't take a lot of effort. However, what is will be different for providers is the ability for them to get these NPIs, so they have unique NPIs for the service and provider type they are providing. Currently, our providers use one NPI, and they could have that NPI across multiple service locations. For instance, if you're a rural health center, you may have one NPI they're using for your clinics that are located in 2 or 3 different cities. what we're asking for as we implement this new law is that each one of those clinics has a separate NPI so we can identify where the services are being provided. Currently, to implement this, the department has draft regulations that we've created. Those regulations are available on our website for providers to go look at and provide us comments. We are seeking comments from providers by the end of June so we can finalize our regulations in July. Then we'll send our regulations to the Medical Services Board for their official adoption and approval. During this Medical Services Board adoption, there will be additional time for stakeholders to provide input and give feedback directly to the department. What we're really trying to do is make sure that our regulations are correct and that the providers understand what we're doing to implement this law. So if you can go to our website, we've set up a special website that's the Colorado Npi Law webpage, and that is available on the slide of this webinar. If you click on that link, you'll be able to you'll download our draft regulations, an additional fact sheet on how we're implementing the Colorado NPI Law. We'd love to get your comments back by the end of June so we can then finalize these regulations. If you do have comments, there's a special email address that you can send to us at the Colorado NPI Law at state.co.us. In those draft regulations, you'll see a lot of detail. There's a lot of definitions that we begin with because implementing these new laws required the department to define a lot of terms that aren't traditionally used. First off, we are defining terms such as what is the billing provider field. This is important for us as healthcare providers. For the most part, when you bill claims to us, you use your NPI as the billing provider, and you're putting your NPI into the billing provider field. That way you can identify where your payments are going, and it's the primary field that you're using to make sure your remittance advice and other things are going to the same location. When we ask you to get new NPIs for service location and provider type, you don't have to change the billing provider field. You don't have to change the data that's going into that field. You can still bill your claims using your current number on the billing provider field to have all your checks and your remittance advice going to the same location. Instead, what we're asking for is to have you put that NPI on another field on the claim. In our definitions, we define the service location field also. That's kind of the third place on a claim. If you're looking at a claim, a lot of times the first field you look at is your billing provider ID. The second field is your referring or your rendering provider ID. And then the third field on that is your service location field. That's where we're asking these new NPIs to be located on the claim. But to have those NPIs located on the claim, you must enroll with those locations and have those locations identified by that NPI. So it is a requirement for providers to go get new NPIs and then update their current enrollment file, or if they're enrolling new sites, to have that NPI associated with the new locations. So what we're asking for is for new providers and new sites to have these separate and unique NPIs by January of 2020. For current providers, we're asking for those NPIs to be updated by January 2021. Under the law, it's a requirement that all providers to have enrollment and to be billing the department with the new unique NPIs by January of 2021. In our regulations, you'll see several definitions that discuss, what is a healthcare provider. So in this, we had to define what a healthcare provider is and what kind of healthcare providers can actually have multiple NPIs. Those provider organizations that can actually have separate NPIs are under the federal regulations called an organization healthcare provider. These are really providers who are not an individual. If you're an actual doctor or an individual, you can only ever have one NPI. That NPI follows you around no matter where you work and no matter who bills for you. So those individuals are not impacted by this new law or these regulations. Instead, we're talking about organization healthcare providers, which are hospitals or other businesses, clinics, things like that have multiple locations and are kind of legal entities who are billing and providing services for the Medicaid program. We also define actually what the kind of Medicaid program is under our regulations, because under the law, it covers 5 different articles of the Medicaid statute. So we are using the term in our regulations, medical assistance program, which covers the Medicaid program. It covers CHIP. It covers our long-term care providers. So it covers every provider kind of group that we have that provides services to the Medicaid program. So don't get confused when you read the regulations when we use the term medical assistance program. We really mean Medicaid and CHIP. Also, the regulations are very lengthy in the volume of definitions we have. So there are actually over almost 60 provider types that we have to define because of this law. With that, you'll see a lot of pages of just defining what a provider type is, such what is an X-ray facility, what is a hospital, what is a rural health care clinic. All these things have been defined in these regulations, and we want to make sure you as a provider go to your specific provider type and read those regulations to make sure we have defined those correctly. Now, the other important definition and the other area of this regulation we really want providers to understand is what do we mean by service location or site where services are provided that you have to get a separate NPI for. When we say a site, we mean a physical location by street address, including the suite number where goods or services are provided to our Medicaid members. This is important for us because for providers who are participating in the department's Accountable Care Collaborative or our primary care alternate payment models, these provider groups need to be specifically identified as make sure our clients are being provided services by the primary care medical providers. We don't want claims for specialists or home health claims or other claims in these algorithms we run for these programs because it puts a bias into our data. So it's very important to us that our clients are being attributed to a primary care medical provider appropriately. So that's why it's very important for these NPIs to be located by site. So as an example, if you are a provider who, let's say you're a rural health hospital and you provide inpatient hospital services, you also have a nursing home attached to your hospital, you also have a clinic that's located outside your hospital. Those are 3 different provider types that are provided in the same location. So you need 3 separate NPIs for those. Now, if you're a home health agency that's also providing hospice services and you have 2 locations in 2 different counties that are separate entities, well, that's actually 4 different NPIs. You need 1 NPI for your hospice in one city and 1 NPI for your home health agency in that city. And then you're going to need 2 other NPIs to identify the hospice and home health services being provided in the separate city. When you bill claims for us using those NPIs, you're going to put down the location of where you're providing service in that service facility location, and we will check that against our enrollment records to make sure that location has been enrolled properly and has the proper NPI. And what we also want to mention is that when you bill Medicare, and Medicare also has this location field, this service facility location, so your claims will cross over to the Medicaid agency. If you're using the automation of the COBA file when you bill Medicare to Medicaid, those claims will also cross over. So you may have to be aware that you have to enroll these NPIs with Medicare. Medicare is also implementing similar conditions that Colorado is that will require providers to use NPIs by location, and they may also be editing on those. We don't have the complete list of all the Medicare programs that are editing on those right now, but this is starting in both the Medicaid and the Medicare program. So with that, we want to encourage our providers and our stakeholders to go out and read our new regulations, read our draft regulations, understand what we're trying to do here. If you have any questions or comments, please email us at our email address. It's Colorado Npi Law @state.co.us. We would appreciate receiving your comments by Friday, June 28th so we can finalize our regulations. I want to thank you for attending our webinar today.